So oxygen deficit, it's defined as the difference between the level of oxygen in the alveoli, those little air sacs,
Right.
and the calculated level of oxygen in your arterial blood. Now, the calculated is key here because we're not doing another invasive measurement. Oxygen deficit is a surrogate measurement for that A gradient that we talked about earlier.
So what is it about the A gradient that makes it so important, and why don't we hear more about it?
Well, the A gradient, it's been the gold standard for understanding, how well your lungs are doing their job of gas exchange. But the challenge with it has been that in order to measure it, you need to do an arterial blood draw.
Oh, ouch. Okay.
Yeah, it's where they take blood from an artery, which is a little more invasive than just pricking your finger. It takes time to process, and it's not something you do routinely,
Yeah.
especially not in situations where you need information fast, like in an emergency room.
Right. Especially in acute care settings.
Exactly.
That doesn't sound very practical.
No.
So that's where this oxygen deficit comes in. This is the less ouchy alternative.
Precisely. Oxygen deficit gives us a quicker and a much less invasive way to get at that valuable information. Instead of needing a blood sample, it analyzes a simple breath.
Just from breathing.
Yeah,
Oh.
you just breathe normally, resting, and that oxygen deficit is simply the difference between that directly measured alveolar oxygen and the calculated arterial oxygen.
Okay.
It's non-invasive, it's reproducible, it's reliable, and it tells us about that gas exchange process happening in the lungs.
So we have this number, this oxygen deficit number. If it's higher than what's considered normal, what does that actually tell us about the lungs?
That's a good question.
Okay.
A higher oxygen deficit indicates that the gas exchange isn't happening as efficiently as it should be.
Hmm.
So there's a bigger gap between how much oxygen is in your lungs and the estimated amount that's actually in your arteries,
Right.
which means some of that oxygen isn't making it across.
Right.
This suggests that there might be some kind of respiratory impairment.
Okay, so what are some of the common reasons that we see this oxygen transfer not working as smoothly? What are some of the causes of this?
Yeah, so the most frequent reasons for an increased oxygen deficit are what we call ventilation perfusion mismatches, often shortened to VQ mismatches.
EU mismatches.
Yeah.
So a higher oxygen deficit is generally a signal that something's up.
Mm-hmm.
There's a problem with how oxygen is being delivered into the blood and the lungs. So how does knowing this number actually help doctors in a real-world setting?
It's incredibly valuable for helping to pinpoint the reasons why someone might have low blood oxygen, or what we call hypoxemia.
Okay.
So it helps clinicians narrow down those causes. For example, if a patient has low blood oxygen and a significantly elevated oxygen deficit,
Mm-hmm.
it suggests the problem is within the lungs themselves.
Right.
Something is blocking that gas exchange, like fluid in the lungs, inflammation, or fibrosis.